Hi, my name is Amy Keel, and this is my health assessment for my FNP class 660. This is my patient Adam. Hi, how are you today?
Good.
Good. I hear you coming in for a health assessment?
Yes.
All right. I'm going to start by inspecting your head. His head appears to be normocephalic. I do not see any lesions, any lumps, any lacerations on his head. His scalp is clean. He does have uneven distribution of hair. Next, we're going to go to your eyes. Your eyes appear to be equal bilateral. They are symmetric with your other facial features. They're blue in color. Your sclera appear to be white. Your eyebrows are symmetric over your entire eye. Your eyelashes appear to be full and long. Your eyelids appear to be intact with no lumps or lacerations or irritations on them. I'm going to pull down your eyes and look into your conjunctiva. Your conjunctiva appear to be pink. I don't see any jaundice. I'll check above. I don't see any lumps or masses in the eyes. Next, we're going to go to your ears. Your ears, the aurelica of the ear appears to be intact. The helix, I see no abnormal moles, no lumps, no irritations, no drainage on the outside of the right ear. And same thing with the other aurelica. The helix appears, the tragomas is intact on both sides. Next, we're going to inspect the nose. Appears to have no lesions or any abnormalities, and your lips appear to be pink and moist. Next, we're going to take the optoscope and we're going to look into your eyes. We're going to test your red reflex and I'm going to look for your ocular disc and macula, and going to check your reactivity to light in your eyes. We're going to check for the strabismus. So I'm going to have you go ahead and cover one eye, and then I'm going to look at you and take your hand down. Next eye. Take your hand down. I see no drooping of the eyes, no lazy eyes. Everything appears to be intact. All right. Ready for bright light in your eye?
Yep.
Okay. Over to the corner of the room. Okay, your optic disc appears to be sharp with its borders. It's yellowish in color. The inner part of the eye appears to be brownish reddish. The macula appears to be in size of 1 dd, and it approximately is at the 3 o'clock position and 2 dd's away from the optic disc. I'm only going to look at the right eye because of timing. Next, we're going to go ahead and test the red reflex of the eye. That's where you're going to look at the red light in your eye and see if there's a reaction. Just look at the light. Red eye is reactive to light. Then next we're going to look at your reaction of the pupils to the eye. Just look straight over there. Pupils are round and reactive to light and equal bilaterally. Next we are going to look into your ears. I'm going to pull up on your ear, and I'm going to look inside the tympanic membrane. Tympanic membrane appears to be intact. It's translucent, gray, and the cone of light is at 5 o'clock position. I'm only going to look at the right ear for right now, just because of time. And next we're going to look into your nose at this point. Okay. Nose appears to be patent. There's no erythema. It's pink, moist, and there's no septal deviation or no polyps seen in either nair. Okay, we're looking to your mouth. Okay, I'm going to use this to pull your tongue down. Ready? Say ah. Alright. Uvula is intact midline. It goes up when patient says ah. The dorsal aspect of the tongue is rough. The palate is intact and it's moist and pink in there. The underneath of the tongue is also pink and moist and appears to be without any lesions or canker sores or anything abnormal in there. Next, I'm going to do the palpation on the face, and then I'm going to do the cranial nerves. First, I'm going to palpate. So, I'm going to go with the temporal muscles, the facial. Do you feel any pain?
Yep.
Facial sinuses, maxillary sinuses, the temporal or the masseter muscles. Any pain?
Yep.
Okay, open. We're going to do the temporomandibular aspect. No clicking, no pain.
Nope.
Okay. We're going to look at the optic arch. Any pain?
No.
The mandibular bones, and then the maxillary bones. Any pain?
No.
All right. Next, we're going to move on to the neck. Neck appears to be supple and range of motion. Move your neck back and forth. Front, go back to front. All right, good range of motion on the neck. I'm going to put my hand here. I'm going to have you press against my hand. Good strength. Good strength bilaterally. Skin tone is even. I see no lumps or no lesions or anything abnormal. I'm going to palpate carotid artery one at a time. Good palpation. That's a +2. Good. All right, and listen for any bruise. Good. No bruise heard on either side. Next, we are going to do the cranial nerves. Along with, I'm going to palpate the trachea. Trachea is midline. I'm also going to have you swallow so we can try and feel the thyroid. And with that, we are checking the cranial nerves 9, which is the hypopharyngeal, and the vagus with his swallow. Ready? Swallow. Okay, no palpation. No palpation of the thyroid. Any pain, anything? No? Okay, we're going to go to the rest of the cranial nerves. The first one is the olfactory, which we're bypassing just for smell. And 2, we're going to do the optic nerve, which is where you're going to read the Snellen chart. Read the furthest line down that you can read.
EPT0, Z-O.
Okay? Oh, sorry. Cover one eye. Sorry, that was my fault. Cover one eye.
EPTZO.
Okay, cover the other eye.
EPTZO.
Okay, do you wear glasses?
Yes.
Okay. Patient does not have glasses on at the time, and right now his vision's a 20/30. Next, we are going to check his 3, 4, and 5, which would be his ocular motor, his trochlear, and his abscess or muscle or cranial nerves. So I'm going to have you follow my finger, just with your eyes, not with your head. All right, 3, 4, and 6 are all intact. Next, we're going to do your cranial nerve 5, which is your trigeminal, which is actually your taste. And then also the sensation of the face. I'm going to have you close your eyes. I'm going to have you tell me when you can feel and what type of sensation it is. Tell me where you feel it at.
Face.
Where at on your face?
Left side.
Okay.
Right side of my face. Forehead.
Okay. And next, we're going to do cranial nerve 7, which is his facial. I'm going to have you bare your teeth. Okay, and I'm going to have you puff your cheeks. Okay, cranial nerve 7 is intact. Also, in his assessment, I skipped the teeth. His teeth are in line, they're white, they're well taken care of, and his gum margins are within, their gum margins are healthy appearing also. Next, after cranial 7 is 8, where we're going to check the acoustic and the vestibulocochlear. So we're going to take a Ryan's fork, we're going to put it in the center of your head. Just tell me if you hear the sound bilaterally in both ears.
Yes.
Okay. Next, we're going to take, that was the Weber's test. Next, we're going to do the Ryan's test, where we're going to put it on your mandibular, and then it's called air to bone conduction. And we're going to see if you tell me when you no longer hear the sound in the back, and then I'll hold it up to your ear and tell me when you no longer hear the sound.
Okay. Okay.
Cranial nerve 8 is intact. We checked 9 and 10, and now we're going to check 11, which is your spinal accessories. Shrug your shoulders. Good job, let them down. All right, and then next is the hypoglossal cranial nerve 12, which I'm going to have you stick your tongue out, lift it up, down, all around. Okay, hypoglossal cranial nerve 12 is intact. Next, I'm going to palpate your lymph nodes. We're going to start in front of the ears. So we're going to do the pre-auricular. Let me know if you have any pain or irritation when I do it. Post-auricular, occipital. We're going to do submandibular lymph nodes, submental. We're going to do the superficial, cervical. We're going to do, I'm going to have you turn your neck slightly this way. Turn this way. This is the deep cervical chain. No palpating, nothing abnormal fell. This is the, you can straighten up, posterior cervical. This is the subclavicular, infraclavicular lymph nodes. Anything, any pain? Okay, lift up your arms. We're going to feel under your arms for any lymph nodes. No axillary lymph nodes. And then we're going to find and feel the epitrochlear lymph nodes, and none is palpated. Okay, next we're going to move on to his chest. Inspection of skin can't do because of a t-shirt, but we are going to percuss and auscultate the chest. His chest appears to be symmetric. It's elliptical in shape, meaning that it has roundness and it has downward sloping ribs. From here, we're going to percuss, starting at the clavicular line. Okay, resonance heard throughout. We're going to go ahead and auscultate the anterior, or the anterior portion, and then we're going to go to the posterior portion. All right, big deep breath. Let it out. 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 All right, lungs are clear, bilateral upper middle lobe on the right, and clear on the left, upper middle lobe, or upper and lower lobe, and there's no adventitious breath sounds such as crackles, wheezes, rhonchi. Okay, I'm gonna have you turn your chair so we can do your back. we are going to check for his expansion to make sure that it's equal bilateral. We're going to place our hands approximately on the 10th inner rib. I'm going to have you take a deep breath and let it out. Okay, symmetrical expansion. Next, we're going to do percussion across the back of the lung fields. Okay, resonance heard throughout. Next, we're going to auscultate. Okay, deep breath. Good job. Deep breath. Good. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Okay, next we're going to check tactile firmitus. I'm going to place my hands and feel vibration. Say 99.
99.
Nice.
99. 99.
Okay, next we're going to do the egophony. I'm going to listen. I'm going to have you say E.
E. E.
Say E, 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 E.
E. E. E. E. E.
Good.
E.
E, E, E.
E. E. E. E. E.
Say E, E, E.
E. E. E. E. E.
Good. E,
E. 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 E.
Good. Next, we're going to do the bronchophony, where I listen, auscultate, and he says 99. Say 99.
99. 99. 99. 99. 99. 99.
Okay, normal muffled sound. And next, we are going to check. Can't think of the other one. Okay, well, we're gonna see if I think about that one when we come back. All right, I'm gonna feel your spine. Any pain?
Nope.
Spine appears to be symmetrical. I'm gonna palpate your kidneys. Any pain?
Nope.
Okay. I'm gonna do some percussion. Okay. You have normal sounds. Tympani heard over the kidney sounds. Alright, I'm going to have you turn around and we are going to listen to heart tones. I'm going to listen to heart tones when you're sitting up, and then we're going to go over to the bed and we're going to listen to heart tones. And lean forward a little bit. Okay, I'm going to palpate the apical. I'm going to have you take a big deep breath. Let it out. Hold for 10 seconds. Okay, pericardial. Okay. All right, we're going to go over and we're going to do the rest of the other part of the assessment on the bed. Okay. Okay, we're going to listen to heart tones, and then we're going to also palpate the apical. I don't feel any bruise or thrills. I'm going to have you lay on your left side just a little bit. See if I can feel. Okay, no bruise or thrills. Alright, I'm going to listen to heart tones. First, we're going to listen to the aortic, which is in the second intercostal space, and it is to the right sternal border. Okay. Next, we're going to go to the pulmonic. It is at the second intercostal space, and it is to the left of the sternal border. I'm going to go Erb's point, which is third intercostal space, and it's the left of the sternal border. And then we're going to go to the tricuspid, which is the fourth intercostal space, left of the sternal border. And then we're going to go to the fifth mitral valve, which is the fifth intercostal space, and it is mid-clavicular line. Heart tones are strong. I'm going to listen for 30 seconds. Okay, heart tones are strong, regular. He's about 66 beats per minute. Next, do you mind if I pull up your shirt? I'm gonna look at your skin. All right, skin appears to be pink, warm, dry. He's got minimal amount of hair. Umbilicus is symmetrical with his abdomen. I'm gonna go ahead. I see no rashes, no lumps, no lesions, no anything abnormal. I'm gonna listen to your belly. Bell sounds are active. You're going to feel or listen for the aortic artery. Which is audible. We're going to listen for the right kidney artery. Just slightly audible left renal artery. And listen to the left femoral. And then the right femoral, which is audible at a 1+. And then we're going to palpate the aortic. Which is hard to palpate. Okay, unable to palpate the aortic vessel at this point. Next, I'm going to do a light palpation on your belly, and then I'm going to do a deeper palpation. You just let me know if you're having any pain. Actually, we're going to percuss before we do. I'm going to do percussion first. Sorry about that. Ready? Okay, tympani heard over the abdomen. Now we're going to do a light palpation. Let me know if you have any pain. Any pain? Okay, no lumps, no masses felt. Okay, now we're going to go deep palpation. So we're going to go a little deeper. Any pain? Okay, next we're going to palpate the liver. Let's see if we can, it's up underneath. Okay, liver border palpable, approximately 6 centimeters. Try and palpate the spleen. I'm going to give a little pressure. Unable to palpate the spleen. Okay, next we're going to do the left kidney. Unable to palpate, and then we're going to do the right kidney. Here, which is also unpalpable. Alright, next we are going to, you put your shirt down. Next we're going to do, check out the legs, the lower extremities, and then we'll move back to the chair. We're going to check pulses. Skin tone is even throughout. He is good skin tone for his ethnicity. He's got hair evenly distributed throughout. He's got some veins that are prominent in his feet. His toenails are translucent. He appears to be good pink, warm, dry. I'm going to feel the popliteal pulses. Which are good at a 2+. Good at a 2+. We're going to do the posterior tibial, which is good at a 2+. Good. We're going to do the dorsal pedius, which is good at a 2+. Alright, next I'm going to do some range of motion. I have you lift your knee up. Any pain? No? Any pain? Turn your good range of motion in his hips. Again, good range of motion in his hips. Alright, next I'll probably have you stand up and we're going to go over to the chair and we'll do your upper extremities. I'm going to have you stand for just a minute and we're going to check your spine. So I'm going to have you go face that way. And then I'll have you go down, touch your toes, and we'll look at your spine. I see no curvature, no scoliosis or kyphosis. Stand up. All right, his gait was appropriate. He walked without stumbling or any deformities. I'm going to have you stand with your eyes closed, facing the camera. Eyes closed. We're going to check for Rammenberger sign. Eyes closed, feet together, 20 seconds. All right, Rammenberger is normal. He's no swaying. Next, I'm going to have you, all right, you can go ahead and sit, and I'm going to go ahead and have you do range of motion with your arms up, down, circle, back. Oh, we forgot range of motion of the spine. Okay, we'll do that in just a minute. Okay, so his skin is pink, warm, dry. He's got retractive skin, which is skin tuger is good. His calf refills are less than 3 seconds. His hands are rough. His nails are well taken care of. They're pink, translucent. Same on the left side. Skin tone good. Even skin for his ethnicity. His good calf refill. Good skin tuger. Even hair distribution in his arms. We're going to palpate his brachial pulse. Alright, it's a 2+. And do radial, which is 2+. I'm going to go to the left side. Which is 2+. And 2+. Next, we are going to do your reflexes. And then we'll do the plantar. Alright, you ready? Okay, good reflex. And then we're going to do the brachial, or the radial. Good reflex. Good reflex. Good reflex. Alright, knees, if you can get them up a little bit. Ready? Ooh, good reflex. Reflexes are good. Positive. Next, I'm going to have you do range of motion of spine. And then I'm gonna have you we're gonna do the Babinski sign on the bottom of your feet. So go ahead and stand up, and you're gonna go range forward, backwards, side to side. Forward, good range of motion in the spine, side to side. Good range of motion, looks good. And now you can go ahead and sit, and then you can hold your legs out. And if you can hold them up, we're gonna do the Babinski sign, which is positive. All right. I think we are good. This is the end of my assessment for my 660 class. Thank you.